Hi everyone, welcome. This is our first Elevate Times Wellness event, and we're very lucky to have a fantastic guest with us today. We've got Susan Prendergast from Alethea, and Alethea Healthcare happens to be an ATB client, so this is it's all working out very well. So I'm gonna turn it over to Susan just in a second here to do a presentation for us. And then we've also got Sherry on the line, who's going to moderate the chat and ask any questions that you might have of Susan. So while we're watching the presentation, everyone who's watching, please feel free to type your questions in the chat, and we'll get to those as well. And even as we're going through the presentation, if there are questions that come up, we'll get to them. So interactive, it's an interactive day over here. So Alethea Healthcare focuses on healthcare of women. Specifically menopause, fertility, annual physical examinations, and bioidentical hormone replacement therapy, which I can't wait to figure out what that is. And much like ATB, they really listen to their customers by setting up appointments that are a minimum of 1 hour, and they offer remote appointments via Skype and FaceTime as well. So very cool. So we're really excited to have Susan here. Susan is the clinical director and nurse practitioner at Alethea Healthcare, and Susan has been a registered nurse and nurse practitioner for more than 20 years. Wow, fantastic. Yeah. And during this time, she's helped hundreds of patients to look and feel their best with customized wellness and healthcare plans. And Sherry Hilton is our moderator, as I said, and she's a senior leader in people and culture. So thanks, Sherry, for being here as well. And that's kind of pretty much the end of my part. So we're just going to dive right into the presentation here. So I'm going to share my screen. So we've got that up on our end here, and we'll go ahead. So over to you.
Thank you. Can I do that back? There we go. Absolutely. All right. Thank you very much. So we're going to talk for the next 20 minutes to half an hour about women's health, and in particular how women can maintain and improve their health as they transition through menopause. And I will spend a bit of time talking about what menopause is, because it can be very confusing to some people because the definition is misinterpreted. We'll talk about why there's such a fuss about menopause, and then offer you some ideas around maintaining your health, preventing disease, and improving your life and long-term wellness as you transition through this stage. We'll also talk about some ways to treat the symptoms that do come along with menopause. So menopause is actually defined as an absence of menses or cyclic bleeding for 12 months. A woman can't be considered as having gone through menopause until that 12-month period has happened. But I think the most important thing for women and people to understand is that menopause is a process. It's not an event, and it's a long process for many women. Some women will start their perimenopause or premenopausal phase as early as their 30s, and some women will have symptoms post-menopause into their 70s, 80s, and luckily for my grandmother, who's 92, continues to have symptoms. So it is really, really important that people understand that this can be extremely debilitating, but it also can be, a lot of the symptoms are treatable, but that it's a long process. And for many women, they don't realize perhaps that they have started going through this transition until they've sat down with someone with some expertise. For many women, we spend a third of our life post-menopause, and so we don't want to spend our life feeling like crap, which is what some of us have experienced. And so our suggestion is that we look at menopause as in a different way, and that this is a transition into a different way of living with a different way of keeping ourselves well and hopefully enjoying that last third of our life. Like I mentioned already, symptoms can begin between 40 and 50, sometimes earlier, sometimes later, and the average age of menopause is between 50 and 52 years. There's many things that can hasten menopause, some very obvious. So smoking can hasten menopause, and the reason that happens is because over time nicotine receptors in our body actually impact how we use our hormones. So if a person smokes, they will potentially start menopause earlier. Low body mass is another reason why someone might become symptomatic earlier or go through menopause earlier. And the reason is because we need body fat to store our hormones. And if we don't have a lot of body fat, or if we don't have body fat, we have a difficult time utilizing the hormone that might have been available to us. Women who have had no pregnancies, the thought there is, and what's reflected in the literature, is that if women have chosen not to have a pregnancy, then they will go through their perimenopausal phase as they should. But for many of us who have not achieved a pregnancy, although we've tried, there may have been indications that we have hormonal issues that have impacted our pregnancy abilities, and so on will affect our menopause. And then other things like chronic diseases, including diabetes and high cholesterol. I talk about those two with all clients because we are learning in the last 10 to 15 years that having a higher level of insulin in our bodies, and insulin is part of that diabetic pathway, actually impedes our body's ability to use the hormones that we have available to us, because insulin sits on the hormone receptor sites. So if you have diabetes, or if you have an elevated level of insulin, or if you've been diabetic in your pregnancy and perhaps are getting on in your age in your years and becoming pre-diabetic again, then we would have to address that before we could talk about actual treating the menopausal symptoms. And then thyroid and adrenal problems would also impact your experience of menopause. Many, many, many women have thyroid problems that have gone undiagnosed for many, many years. I would say 90 to 95% of my patients have had an undiagnosed hypothyroidism, which is shocking. And a lot of times their perimenopausal symptoms can be blamed solely on the thyroid. So it's really, really important that we address those issues. If the thyroid and the adrenal glands aren't working, it will impact how we make other hormones. So hence why it's indicated in perimenopausal care. This is just a little review of what normally happens in our body when we go through our cycle. Our body tells our ovaries to recruit eggs so that we can get pregnant. And this happens in a cycle, roughly every month. And estrogen is then produced at high levels in order to develop that egg so that it can get fertilized and released. Or released and then fertilized, hopefully the other way around. And then more hormone is recruited in order to maintain that fertilized blastocyst until it implants in the uterus and can grow into a placenta and a fetus. And if we don't get that implantation, then progesterone rises and both the hormones eventually drop, and that's how we bleed every month. So it's a very intricate feedback cycle of hormones. The hormones that are important when we're cycling and bleeding are follicle-stimulating hormone, estrogen, luteinizing hormone, and progesterone. As our cycles change and as we age, usually after 40 years of age, our ovaries become less responsive to the follicle-stimulating hormone because there's really no eggs left. And so we get higher levels of follicle-stimulating hormone and higher levels of luteinizing hormone to try to make more follicles come out, but they're not there. And so hence you see that drive up of that estrogen, up and up and up every cycle, to try to recruit those eggs to be fertilized, and they're just not available. So our bodies sit with this high level of FSH, high level of LH, and high level of estrogen. And yes, they do drop as we don't become pregnant and then slough off the internal lining of our uterus. But usually what happens over years is that estrogen level stays very, very high in comparison to the progesterone. And that is really what gives us the symptoms of menopause, is a high level of estrogen and a low level of progesterone in the very early process. Estrogen and progesterone are both really, really important hormones to female reproduction. Estrogen builds up our uterine lining so we can make place for that blastocyst to implant. It helps when it's normally elevated, it helps our thyroid to work properly, it helps our pituitary gland to work properly, and over the long term, estrogen is really important to maintaining a good cardiovascular health and good uterine lining and so on. But when the estrogen is really, really high and the progesterone is really, really low, you can see what happens on the screen, where you get the significant effects of estrogen become even more significant. So women gain weight. They have issues with their thyroid hormone because they've got a higher influence of estrogen versus progesterone. Estrogen impairs our libido because it affects the balance between estrogen and testosterone, which is our libido hormone. It also increases our risks of cancers and diabetes because it's sitting at such a high level in comparison to the protective effect of progesterone. And you can see the benefits of having a good level of progesterone there is that it kind of weighs out the bad effects of estrogen. So if you can understand that estrogen is sitting very high and progesterone is low, and that's a normal process, but you can see then why women might have some very obvious symptoms. So gaining weight, some women have significant headaches because progesterone protects against that. We may have issues with our libido. So like I said, we also get a whole bunch of other symptoms that are very normal because our estrogen is sitting high and our progesterone is sitting low. Things like hot flashes and night sweats, those are blamed on low levels of progesterone. Irritation or quick to anger is also because of a low level of progesterone. Progesterone is our happy hormone. Women who are put on progesterone supplements will almost immediately recognize a change in their mood and their ability to deal with stress. So if you have a high level of estrogen and a low level of progesterone, you can understand why we might be quicker to anger or irritate. I understand that there was some opportunities to share experiences. This was the thing that happened to me that made me understand how significant menopause can be to a person's life. My mood changed very drastically, and progesterone really has helped me to become more of myself. The other thing that a lot of women complain about is their brain fog or a difficulty concentrating. This has also been implicated as part of the role of progesterone, but more likely would be an explanation of the thyroid not working properly. And again, because estrogen and high levels of estrogen can impede thyroid function, that would make sense because it stops our thyroids from actually producing thyroid hormone as it should. Lack of sleep. High levels of estrogen and low levels of progesterone and a disbalance between all of the female reproductive hormones can actually change our sleep cycles. So if we're doing really good sleep hygiene and still not able to sleep through the night, this can become problematic for women. And a typical story would be waking up at between 2 and 4 in the morning and not being able to get back to sleep. And 9 times out of 10, this is a symptom that people don't recognize as part of perimenopause. They think it's because most of us, when we're going through menopause, are at the peak of our career. We're busy with kids and parenting and work, and also perhaps even looking after our own parents and being in relationships and so on. We think that it's the stress that's keeping us from sleeping, when in fact it's probably a lack of progesterone. The weight gain that comes from high levels of estrogen is also very common complaint, and it's weight gain with no change in anything else in your life. You haven't switched to a really high-fat diet and stopped exercising completely, and you start to gain some weight in the middle around your abdomen. Changes in your cycles, a lot of women will say that that's how they knew they were getting close to menopause, when they started to have very odd cycles, so really, really long or short, and then maybe bleeding for a different number of days than they had in the past. Some women, it will be so drastic as that they will not stop bleeding. And so the typical treatment would have been to do some treatment of the endometrial lining or a hysterectomy, for heaven's sakes, but now we know that we can actually treat with hormone. Vaginal dryness and loss of libido are also very, very common, but they tend to be the things that people speak about the least. Many women will feel that their loss of their libido is simply because of changes to their lifestyle and their relationship over the years. But really, when you look at their blood work, they have no testosterone left in their system. And you give them a little bit of testosterone, and all of a sudden they are interested again, which is super nice for some people in the household, I'm sure. And then oftentimes the two will be linked, vaginal dryness and loss of libido, because there can be some vaginal dryness that happens naturally as well because of this low level of progesterone and higher level of estrogen. And women will experience some pain and discomfort with intercourse. So the two things oftentimes are hand in hand. And just before I move to the next slide, I just wanted to say that oftentimes women will have many of these symptoms altogether. So it won't be one thing that they're experiencing. And so if you can imagine that if you're having hot flashes during the day, night sweats at night, you can't sleep and you are quick to anger, how that could affect your relationship and your relationships. And a lot of women do come to me and talk about the fact that it's ruining their life. So this is a common unfortunate problem. Over the long term, the changes to our hormones that, again, this is a normal process, but because we're living longer, we're realizing that having disparities between our hormones, so low testosterone, low progesterone, and eventually your estrogen also lowers once you've gone through menopause. So having low female hormone for many years past menopause can put our systems at risk in even bigger ways. So we can lose bone mass. We are actually at higher risk for heart attacks and strokes, and also for female cancers. And when I was learning about this, I thought, well, that makes sense, because I know as a nurse practitioner in my family practice that we worry about and start screening women when they're 50 years and older for cardiovascular risk and cancer. And that's because we don't have the protective nature of the hormones on board. So really long-term health is also affected by going through menopause. And then we also see changes in how our hormones influence our urinary tract and the pelvic floor that protects our bladder and our bowels and our uterine lining and so on. And we see a lot of women experiencing incontinence as well. So for long-term health and wellness, it's a really important thing to understand how your hormones influence all these systems. So things that you can do, any one of us can do, to maintain our health as we're going through perimenopause, menopause, and we're in our postmenopausal life, is to not smoke. That's the biggest one. To eat well, obviously, and exercise. And we're never proponents in our practice, or most clinics actually in Canada, of eating a particular type of diet. Something that you're taking in a high number of vegetables and fruits a day, and healthy grains, minimal red meat. But no, we don't recognize or promote keto diets or paleo diets or gluten-free diets or anything. It's just really about eating as clean and whole as possible. One thing that I continue to have to work on in my life. Also exercising, so trying to get your minimum 30 minutes a day if you can, and sleeping. And so using good sleep hygiene, where you go to bed the same time every night, try to wake up roughly the same time every morning, minimizing screen time, etc. Managing and balancing your stress, and then as well, moderate alcohol intake. And usually women laugh when I say moderate alcohol intake, because what does that really mean? But the new guidelines allow women to drink 1 to 2 small glasses of wine 3 to 4 times a week. It's not included, it doesn't include highballs or beers. So, you know, a small glass of wine is kind of your goal. And of course, the biggest challenge, I think, for most of us is stress management and balance. So doing things like yoga, if that helps you. For me, it's more exercise. It's really important. Getting outside, being in the sun is also really important to our health. And then preventing disease, you also want to make sure that you have a good healthcare provider that is on top of keeping things screened. So making sure you have an annual breast exam, an annual PAP, or cervical exam at minimum every 3 years, but the literature changes every couple of years about that. Checking your heart every year, including having an ECG, and then having your stools checked and then having a full physical at least once a year as well. And that should also include blood work. So if this isn't something that you're already doing and you're past 35, it certainly should be part of your discussion with your primary care provider. Don't tell him or her that I sent you, but that's how it should be. As far as breast exams go, the current recommendation is that as soon as women hit 50, they should be having a mammogram every 2 to 3 years. Depending on your risk, you may have it, a mammogram sooner. And there's also a lot of discrepancy in the literature as to the value of a mammogram, but that's not the topic of this conversation, so we'll leave that one for another time. Now, before we get into the medical management, I wonder if Sherry, I'm sure there's lots of questions, and I'm going pretty fast, so should we maybe pass it over to Sherry for a minute and see if there's any questions that people want to ask?
I think that's a great idea, yeah. I think Sherry may have muted just to keep the flow going, but Sherry, if there's any questions from you or questions on the line, do we want to take a quick pause to check in?
Yeah, absolutely. I was putting some questions into the chat, and Tara let me know that they're not showing up, but I did, well, I'm actually not seeing questions from anyone at the moment, but I was really curious around some of your comments related to, you know, it's a process, not an event. That's what really hit me hard when you first started talking about this. And I'm just really curious, so I'm just going to put it out there to the group who's listening. You know, what is surprising for you as you listen to this? It's absolutely fascinating information. So what's surprising you? Would love to see your comments into the chat around that, or, you know, big aha moments that you're having. For me, it was really that it's a process, not an event, because in my mind, I'm thinking of this as just this small little kind of 3-year period in someone's life, my life, other women's lives, and then it's over. So that really hit me hard. So I'd love to see any other ahas or surprises in the chat.
Yeah, it was quite interesting to hear that hormonal analysis and how different hormones fluctuate and what a big impact they have. That was great.
I think just to address your comment, Sherry, I hope that doesn't scare everyone either, but
yeah.
For many of us, and I think when we start to talk when I start to talk face to face with individual women, many women struggle with some of the changes that they don't realize are even part of this process. And so maybe normalizing the length of that process might be helpful, and to encourage people to start having conversations with their friends or a healthcare provider who has some expertise in this area. And I'm not here to doctor bash, because that's never my goal, but to make sure that you've got somebody that is going to listen to your concerns and has some expertise, because a lot of times our complaints and our symptoms are pushed aside or not recognized as being that meaningful to our life, and they seriously are. So really just trying to normalize that this is a long process for some women. I will say I've met a couple of clients just through my primary care practice that went through menopause and didn't even notice. So, you know, that's also a reality for some as well.
Interesting. Yeah, it seems like, as with many things, it's individual. And
absolutely. And there's extremes on both ends. Some women will be completely devastated by their process. Others will move through their life and not even really recognize what's happening until they've recognized that they haven't had a period in a year. Oh, wouldn't that be nice?
Yeah.
Okay.
Cool. Shall we continue?
Sure. Awesome. Okay, so moving into the treatment options. Like I had mentioned before, exercise is a really important approach to managing symptoms. For many women, the small or short-lived endorphin rush is enough to actually stimulate their endorphin for the rest of the day. That they and the benefits of getting outside, especially into the sun, we know that there's some significant benefits from sunlight to our mental health processes. So that is a huge piece. I would recommend everybody to try to get outdoors when they can and get some exercise regularly. Stress management and counseling or therapy. In my practice, I do actually refer and utilize other supports a lot of the time, specifically therapies around dealing with mood and stressors in people's lives to allow them to actually transition through this process in a better way for them. In other situations, it may be more of a counseling. In particular, couples therapy is oftentimes warranted. Some women do come and tell me their stories of their relationships, and so oftentimes the couples counseling will become part of that treatment. I'm going to talk about diet for a second. I again said we aren't a proponent of any particular type of diet, but making sure that you're eating healthy meats, so minimal red meat intake, high fish intake, in particular salmon, and if you don't eat that sort of stuff, then supplementing with nutraceuticals, and high vegetable and fruit versus saturated fats and salty snacks and things like that. I also do recommend some nutraceuticals or high quality vitamin supplements because they are really important for long-term health. So making sure you're getting enough vitamin D supplementation, because we can't eat enough vitamin D in our diet. It's not possible to have 12 cups of spinach a day. And rarely do we get enough sunlight. So we do recommend vitamin D supplements, omega-3s, for some women B12, some vitamin A, and maybe even some iron. So as part of our approach to managing perimenopause and actually just wellness, examining some of the levels of those vitamins and minerals in your body would be important. And then the other option is hormone replacement therapy. And I'm going to only briefly talk about this because we don't have a lot more time, but I'm certainly happy to answer questions. There's different types of hormone therapies that are available. And unfortunately, for many years, hormone therapy was poo-pooed in the medical world, which is why a lot of our medical practitioners aren't aware of the benefits of hormone therapy, because there was some trials done in the 80s and 90s that with different types of hormone that were shown to be dangerous, when we know now that they weren't. And so on the right-hand side of the screen, you see the WHI trial, which is the Women's Health Initiative trial. They used horse estrogen and a different type of progesterone to treat women's symptoms and look at long-term health. And they actually stopped the studies because there was women in the studies that were becoming unhealthier. But when we look at them in retrospect, these women were well past menopause. So they were 70 and 80 years old when they started these therapies. And we're now using different hormones. So we can move past those trials finally and look at different types of therapies now. And the one that we use most in our clinic is bioidentical hormone therapies, but there are also big pharma therapies available. We use estradiol, which is manufactured or compounded specifically for you and your needs. Micronized progesterone, so you can see that at some point you may need to be taking both estrogen and progesterone. But early on in the process, you can take progesterone and testosterone as well as thyroid without any worry that it's going to cause any harm. We use both big pharma, so Synthroid as a thyroid treatment, or desiccated, which is the natural pork source thyroid. And then we also have DHEA, which is an adrenal hormone, melatonin, which is a sleep cycle hormone, and many, many others that we can, that your provider or someone that has some expertise in hormone replacement therapy can offer. The benefit of bioidentical hormone replacement therapy is that, like I said, it's compounded in the pharmacy specifically for you based on your needs versus having to be stuck to a certain pill availability. There's benefits of BHRT for both men and women. Today we're focusing mostly on women, but you can see the obviously treatment with progesterone would help with night sweats and hot flashes. Post-menopause, you can also add in a little bit of estrogen, which will protect the bones, but will also improve hot flashes and night sweats. But we do it in a balance so that you're getting a higher level of progesterone than estrogen, so that you're actually in balance. Progesterone and estrogen will also impact vaginal dryness, pain with intercourse. Testosterone helps with libido. We also have DHEA, testosterone, and progesterone that will help with fat loss and muscle tone. Progesterone helps with mood, memory, and concentration. Thyroid also helps with those things. So lots of significant immediate benefits, and then your long-term benefits would be bone health, heart health, mental health. And then there's also this interesting little tidbit that I just learned, that you can actually put estrogen on your skin and it helps wrinkles. For those of us who, yes, who knew? For those of us who are interested. And this is just to know who we are in case you wanted to reach out or ask any more questions. We're Alethea Healthcare. I think I made it in my 30 minutes, so we can turn it over to any questions that might have come forward.
Fantastic. So I'm just I'm multitasking here.
Awesome.
Yeah. So we can I think stop presenting our screen so everyone can see us. I don't want to screen share anymore. Here we go. Okay, I think it's back on us. So Sherry, I guess I'm just kind of chatting with Tara on the chat here too, and it sounds like between Sherry and I, we can try to figure out who can see some questions here from the chat. But there's lots of great comments, which is fantastic. I just opened it. Yeah. So we've got a question from early on from Rachel. So if you choose not to have a pregnancy, you'll likely go through menopause at the regular time. Right. But if you've tried and haven't been successful, you might go through earlier. That's correct?
Yeah.
Okay.
So I'll just use an example. Myself, I started going through perimenopause when I think back, probably in my very early 30s, and had significant difficulty getting pregnant, had to go and do in vitro fertilization to have our son. The two things are very much hand in hand. If you have issues with fertility, you're most likely going to start menopause early, or you may have a very easy time going through it because it could have been that you'd started your menopause already. So for some women who, and I'm doing a fertility talk, I think next month or the month after, but for some women, when they start telling me that they've been having some issues getting pregnant, one of the major things to do is look at all of the same hormones that I would for a person who's going through hormonal changes for perimenopause or menopause. Because a lot of times it's just making a slight change, adding a bit of progesterone perhaps, especially for those women who have had losses. They can get pregnant if they can't keep the baby for whatever reason. Sometimes it's just an inability to have enough progesterone, so their estrogen progesterone isn't in balance and they end up losing pregnancy. So it's really about looking at that hormones, and they're completely linked.
Yeah, it really seems like a big picture.
It is.
That like lots of things tie into.
Yes.
I'm learning so much.
The other thing I forgot to mention is that you can go through menopause for many reasons. Some women will go through forced menopause when they have a hysterectomy. So they may be put right on hormone therapy right when they're finished their surgery. And the purpose of that is to prevent them from all those long-term risks, because some women will have their hysterectomy in their 30s. Then their bones are at risk, their heart's at risk, they're at risk, higher risk for cancer. So putting women on hormone therapy is really common for people who have hysterectomy. But you could also have premature ovarian failure, which is what I had. I started going into menopause very early, hence couldn't get pregnant. So, but if you had no issues getting pregnant, or you didn't have a pregnancy, so you don't know any different, you're most likely going to go through menopause at the regular time versus.
Interesting. Yeah. Okay. Good to know. Thank you. So we've got some lots of really good comments and appreciation for doing this. So thank you very much for doing it. I'll say that, I'm sure, a number of times. So we've got some sort of, this is an interesting, it's not really a question, but comments around estrogen.
Okay.
Sort of estrogen is the devil stuff. Yeah, so can you tell us a little bit more about that in terms of natural levels and taking supplements?
Yeah, so estrogen can be looked at as the bad hormone. But when you look at the long-term benefits of having estrogen, it's actually quite protective in and of itself as well. And it's interesting that it's the one that changes the last. So if we lose estrogen only after we've gone through menopause, and there may be some sort of evolutionary reason for that, because it protects our bones and it protects our heart. And so yes, there are benefits to having estrogen, but as far as symptoms go, it's not really that estrogen is the bad one, but you just don't get the benefits of the really good one, which is progesterone. So your estrogen is sitting really high, your progesterone is sitting low. It seems like estrogen is the culprit here, but really it's the lack of progesterone that's the issue. So really it's not estrogen's the bad guy.
Interesting.
Because it is protective as well.
Right. Interesting. Okay. Question about alcohol intake.
Yeah.
Can we talk a little more about that? Yeah. So what is moderate intake? Yeah. How does the wine relate to different ones.
So there has been so much change in the literature around what's adequate or too much alcohol intake. A couple of years ago, the guidelines changed from 4 to 5 servings of alcohol per week to 7 to 9. So that's pretty significant. So 9 servings of alcohol. That seems like a lot to me, but a serving is 1 to 2 ounces of wine. So that's not very much. That's like a tiny little bit. So if you think about, having 2 glasses, not even glasses, 2 ounces of wine, a couple of nights a week, then you're fine. If you're using 2 ounces of alcohol, like vodka, 9 times a week, that's a different story. So you have to kind of put it in perspective. And the guidelines aren't clear because it just says servings. 9 bottles of beer a week, that seems like a lot to me, but I don't drink beer. So there you go. It's not as clear cut. I would recommend having a discussion with your family doctor if you're interested. But again, there's really not a good understanding of what is okay and what's too much. The biggest difference in the guidelines is around, if you're thinking that you drink too much, is around whether or not you wake up feeling crappy, if you can't function without alcohol, or if you're having illness because of the amount you're drinking, then that's a sign that you're drinking too much. So they say that that's kind of a safe way of managing or understanding if you're drinking too much.
Gotcha. Sounds like they could use some user experience
Absolutely.
help and research.
Absolutely. And remembering that the alcohol intake guidelines are like a lot of the other guidelines. They're developed by experts, but they're not necessarily always rooted in strong trials. So, we just know that if you start to get sick because you drank, or because you don't have alcohol in your system, then we know there's a problem. Right. So that's kind of my spiel.
Gotcha. Awesome. Okay. Is there a way of testing hormone levels at home or over the counter, or does it have to be done by a doctor?
Yeah, it should be done by a medical provider, and I would really encourage you to speak to, again, somebody who has expertise. You should not have to pay for this. Nurse practitioners and family physicians and specialists can get your blood work ordered for you anywhere across Canada for free. It's part of your healthcare payments that you pay in your taxes. A naturopath can also order blood work, but you will have to pay for that. So again, if you want to pay for it, great, but you don't have to. It's finding somebody that knows what to order and how to interpret the blood work results that's the issue. So for example, for me and us in our practice, we don't treat women's thyroids necessarily to the blood work results that we see. I've had so many women come to see me and been told they don't have a thyroid problem and their levels are normal according to their blood work, but they're highly symptomatic. So I don't always go by what the blood work results say. So it's really, really important that you find somebody that knows how to interpret it and what to order. And the insulin levels should be part of that examination because, like I said before, a lot of people don't know that they're pre-diabetic, and insulin's a huge factor in your body's ability to be able to use the hormones. So insulin, thyroid, female hormones, cortisol levels, all that sort of stuff should all be checked.
Dig in.
And it's a lot of blood. We spend a little bit of time warning our women before they go to the lab. It's anywhere from 8 to 15 tubes of blood, depending on what they're getting or checking for. But again, if you don't have to pay for it and you're given a good heads up, then let's have a really good look at what's going on.
Awesome. Cool. So I've got kind of a twofold progesterone question.
Okay.
More progesterone, what are the risks? Is that a pill you take, and do you need a prescription? And what are the side effects if you do take progesterone?
Okay. So progesterone can be taken 3 ways. It can be taken as a capsule, compounded capsule. So I tell them how much progesterone to put in the capsule, and you take that at bedtime. And because you're taking it orally, it's metabolized in the liver, and the side effect to oral progesterone is that it makes you sleepy. And that's what we want. We want to take it at night because progesterone helps us sleep. So for people who have sleep issues, you get the benefit of the mood changes because progesterone's a happy hormone. Plus it helps you sleep through the night, so you get to sleep through the night. We all wake up feeling a little bit more refreshed, and there you go. So it's a side effect, but it's also a benefit. You can take the progesterone in a cream. It's not as easily absorbed. You don't get as much absorption. You don't get as high of a dosage of absorption as you do from the oral, but you bypass the liver, so you don't get the sleep side effect. So if that's a huge issue for you. And then you can also take it as a troche or a lozenge, so you just stick it under your tongue. I use progesterone at night, and I also use the lozenge because I like to have a bit of progesterone on board during the day because I get moody. So there you go. Yeah. So the happy hormone can be on board all day if it's necessary. The risk of progesterone, if given in extremely high doses and it's not the right type of progesterone, so it's the old school kind, can cause cardiovascular problems. But the type that you should be getting prescribed is safe, and there is no side effects except sleep. So, yeah, it's a pretty awesome treatment. Yeah, no kidding. I had nobody ever complain about it. So, yeah,
good. It's a good overview. Yeah, it's your review, I guess. So this is sort of going into some a comment and a question and like a lifestyle question. So I just have to share, Diana Ward, thank you for sharing this comment. It's crazy.
Okay.
So she said she's found it challenging to get doctors to check and buy into my symptoms, and her GP told her to stop reading Oprah, which is astonishing. That's crazy.
Yeah, or you're not supposed to listen to Suzanne Summers, even though she's really the impetus for this being so huge in the States. Like, it's huge in the States.
Interesting. Mm-hmm. So that's crazy. Yeah. So then Tara kind of follows up with a good question. Do any of your clients tell themselves or tell you a story like, am I just a bad mom or a wife, and then learn that it's biological?
Yes. Yeah, absolutely. That was what happened for me. I thought I was becoming this horrible, terrible person until I realized that actually there was something going on that I could do something about. And I hear this all the time. And I'm not kidding you about women talking to me about their relationships, because for a lot of us, we fly off the handle. We're crabby with our kids. For me, it was my dog, my poor dog, and my poor husband. And so, yeah, we feel awful about how we're behaving and how we are reacting to things that perhaps maybe don't need that sort of a reaction. And then you just continue to beat yourself down, which we do anyways, especially as moms. It's such a horrible thing, mom guilt. And the other important part of this is that a lot of people don't listen. And so, yeah, I had to find somebody to listen to me, and was able to get help finally with a person who had some expertise in doing hormone replacement therapy. And I've since done tons of courses and learning, and now I'm able to help other women. But a lot of it is being persevering and just going and trying to find someone else that'll listen to you. Yeah, it's really frustrating. Mm-hmm. I know. And unfortunately, and I hate to be a man basher, but a lot of the doctors are men, and they don't get it. Like, I'm sorry, but they don't get it.
Yeah.
So
totally.
Yeah.
Oh man, you got this, ladies. Just keep going, keep pushing.
That's right.
A question from Jessica. So, is there any correlation or genetic identifier based on when maternal lines went through it? So, like age?
Yeah.
Does that make sense?
Yeah, absolutely. There is sometimes, not all the time, there isn't any evidence in the literature that because your mother went through menopause at 50 that you're going to go through it and this is what it looks like. And I think we know why that's the case, and it's because with every generation we live our life differently. So, for example, I mentioned my grandma is still having symptoms at 92, heaven forbid. My mom had a total hysterectomy when she's 32, so there's a difference in that generation right there. Then there's me, who has a whole different situation. And that's how it usually is with families. But if there's a set of girls that are sisters, biological sisters, you might see some similarities between the generational experience. But you don't always see it. So if your mom had a really easy time, it doesn't mean you're necessarily going to have an easy time. We just don't really understand it that well.
Okay, that's the bad news.
Yeah.
If your mom had a hard time, you may not have a hard time.
That's right. There you go.
Cool.
So half empty.
Yeah. Awesome. So great question from Rachel, backed up by Tara.
Okay.
What's the best way to be supportive with a family member, friend, or coworker going through menopause?
I think it's really the best thing to do is not only try to be understanding, but to maybe be open to having a conversation. And the brave person is the person who will sit down and say, I'm concerned. I've seen some changes in you. What can I do to help? What's happening? You might not be a coworker necessarily that would feel comfortable doing that, but I think to a family member, you know, that's what sometimes will happen in couples. The one partner will sit down and have a conversation with the other partner to make them realize what they are seeing is happening, and without being too defensive, we might be able to get some resolution. But understanding if you think you see what's happening, you know, maybe just opening the door to conversation. And I think the other thing that happens I also work in a large institution with a lot of other women, and we want to minimize the amount of back chatter. So really just being honest and kind. I think as women we need to be kind to each other.
Oh yeah, this is a great start.
Yes, I know.
So Sandy asks if we could go over some of those natural treatments again really quick.
Absolutely.
Just some of the natural things you can do. I guess.
Sure. The natural stuff or the lifestyle stuff? And vitamins and supplements?
Yeah, maybe let's do both. I assume maybe the lifestyle stuff.
Okay. So one of the first things would be, and I think it's the biggest challenge for a lot of women is diet. So making sure that you're eating healthy, and not necessarily by Canada's Food Guide, because Canada's Food Guide is currently being actually redone. So we don't want to have that much meat and fats. So high vegetables, high fruits, whole grains, and if you can eat them, and light meats, so light protein, so fish, salmons, white chicken. Exercise. So the guidelines actually are, I believe it's 60 minutes a day, 6 days a week, which is really highly difficult for most people. So some people will do 30 minutes a day, 6 to 7 days a week. If you can do that, or an hour, 4 or 5 times a week. I don't do that much. I wish I could, but I don't. So that would be the two major lifestyle stuff: no smoking and minimizing alcohol intake. The other things would be supplements like vitamin D. So the current guidelines are 800 international units a day. We know that that's not sufficient. So there's some change happening in the literature, and they're going to start increasing that to between 1,000 and 5,000 international units a day. But you shouldn't be taking any more than 1 to 2 without some guidance. And then vitamin A, omega-3s, vitamin B12, a multivitamin if you're into that, and timing to time those things is really important. So you don't, and magnesium is another one. You never take iron with anything else. And the only thing you should be eating with iron, if it's in a multivitamin, is a glass of orange juice. Same thing if you're a red meat eater. If you're trying to get the iron from a natural source, eat the iron with orange juice or some sort of citrus, because the citrus helps your body break down the iron and use it better. Cool. So timing of all that stuff is important.
Okay, cool. And maybe consult if you're
absolutely. And you know, some of the really, some of those like an Optimum Health or Sangsters or any of those like wellness kind of places are pretty good. They do have some good advice there, but definitely having a discussion with your naturopath, your acupuncturist, your nurse practitioner, your medical doctor, somebody else like that would be a really good person too. So highly recommend acupuncture and naturopathy as well.
Cool. We've got a question that may be a TMI warning, but I think anything goes here. I think we're cool, safe space. Do you think there's an age that's too old to be on the pill? Trying to prevent heavy periods and things like that. Kind of looking at
that's a tough one, because the hormones that are in the pill are actually the old hormones. So, and I don't know so most people are aware of that.
Yeah.
So, if you're using the birth control pill for menopause and it's working, as long as you know the risks of having those hormones on board, then absolutely it's fine to continue to stay on it. And unfortunately, for a lot of people, the person who prescribed the pill for menopause symptoms may not be aware of the risks. So you are at higher risk for clots when you're taking the birth control pill. That's why we don't prescribe it to young women anymore if they smoke, because we have a lot of women who have strokes when they're in their 20s.
Wow.
So this is just something to kind of be aware of, but it is a common treatment for the symptoms. Can you get better treatment? Sure. Yeah, you can. But are you willing to go off the pill? Because that's the other issue. I do have women that will come to us for bioidentical hormone replacement therapy or exploring the option. But in order to even get your blood work done, you have to be off the pill for 2 cycles. Wow. Because the estrogen and progesterone has to be in the body.
Okay, so the pill plays into it.
It does.
There are lots of factors there.
Yeah,
okay,
absolutely.
Interesting. Is there a difference, and what is the difference, and your thoughts between HRT, so hormone replacement therapy, and bioidentical.
Okay, so even with hormone replacement therapy, most of the big pharma products do use the healthier hormones. Okay,
cool.
So one example is some people will get prescribed Prometrium, which is the big pharma version of progesterone, micronized progesterone, and it comes in a capsule. The issue with the Prometrium then is that it's only available in a certain dose, because large manufacturers are only going to make one dose, right? They're not going to make multiple doses. Whereas for us, we, like any bioidentical person, can put that micronized progesterone in any dose, in any form.
Gotcha.
So the Prometrium, you'll take it at night. It'll make you sleepy. If you're a person who can't take the sleepiness, then you need it in a different version. That's when you might do the bioidentical, because you can get the micronized progesterone put in a troche, a lozenge, or a cream for daytime use.
Gotcha.
That's just a good explanation, I think. There's huge benefit to big pharma version versus bioidentical. It's just about the compounding for the format of delivery and the specificity for the patient.
Yeah. Okay. Cool. Can you take progesterone long term?
Yes.
Yes.
Yeah. Although a lot of people will ask me, how long will I have to take these therapies? There's no reason to stop if it's stopping you from having symptoms. And if it's for protection of your bones and your heart and your head for strokes and your cancer risk, then long-term use is fine. There aren't any studies that have been done in women into their 90th year, but we're getting into doing long-term studies. There are women in their 70s and 80s who have been on it for 20 years. Mm-hmm. So, I mean, there's no risks. Yeah. As long as it's managed properly and dosed appropriately, and you get an annual checkup and everything's kind of revisited to make sure your health status hasn't changed.
Cool. Okay. We're pretty much at the end of our questions in the chat, and this is great timing. So we do have a little bit more time. If anyone has any more questions, feel free to throw them in the chat. I've got my eye on them here. What I thought I'd do kind of in the meantime is just lots of good engagement and appreciation for this conversation. So yeah, thank you so much for being with us. If people want to follow up with you, how do they do that? Where do they go?
Yeah, I had the slide up. So it's Alethea Healthcare. You can give us a call. I'll just give us, am I allowed to say the phone number?
Yeah, absolutely.
Okay, so 780-293-6999. I just had to check with my business person here. We also do Skype and telephone consultations, so we can speak with people across the country. As a nurse practitioner, we're able to order blood work and do prescriptions, etc., for anybody in the country. So you're not limited if you're outside of Edmonton or even outside of Alberta. We are available also online. If you look up bioidentical hormone therapy therapists Alberta, we're on a large website service that will refer you to us as an option. The business name is Alethea Healthcare. www.alethea.com.
Awesome. And we'll be sure to post that stuff.
Absolutely. Absolutely.
Yeah,
Great.
We'll do that for sure too.
Excellent.
So I don't think we have any more questions in the chat, and I will toss it to Sherry. There is just one clarifying thing here.
Sure.
So the old hormones that you kind of mentioned that are in the pill, are those the ones from those previous trials?
Yes.
Okay.
So they are still used in some products, in particular certain types of birth control. So your medroxyprogesterone, that would be the one that would be in the pill, and that was the ones that were used in the Y trials. They are considered safe as long as you're screened appropriately for use, etc. Same thing with the equinestrogen. They're both used in birth control pills. So there has been some discussion in North America and Europe about we actually need to revisit that. Because, and I'm sure everybody's heard about the multiple times when young women are having clots and strokes and stuff. I mean, it's not new. I don't know if you knew about it, but it's something that we all know in healthcare. So those are what's in birth control pills. If you're looking for birth control options, one thing we always talk about in our clinic is the value of an IUD, because you can do without the hormone. So anyway, but yeah, they are They are more of the old school, old style hormones.
Interesting. Okay, cool. Yeah, we'll see if anyone else has questions on that too. We can take them in after and sort those out. One more question, and then I'll toss over to Sherry to wrap up for us. So, can you comment on if there are any fixes for the brain fog and libido issues, and if you've seen weight loss techniques that work?
Yeah. So brain fog, and in particular, oftentimes is related to thyroid. And I mentioned before how a lot of women will come to us and will have untreated hypothyroidism, where their thyroid levels are higher, thyroid stimulating hormones are higher than they should be, but highly symptomatic, so this brain fog, etc. With bioidentical hormone replacement therapy practitioners like myself, we want to optimize thyroid. And by optimizing, we're putting that TSH down as low as we can, so almost getting rid of that stimulating hormone, because that's what actually is demonstrating the issue with brain fog. So putting you on a little bit of desiccated thyroid, or a lot, depending on what you need, usually addresses that brain fog. The libido is testosterone. And testosterone is delivered in a cream only. It's a highly, you only need a little bit for a big effect. And it's only delivered in cream. And so you would put that in your vagina, actually. But it works really well. And one of the side effects, we didn't talk about this one in particular, but would be some women do get a bit of hair growth or some acne with it. So it can be taken either daily, every couple of days, once a week. Really just depends on what the woman would need. But
interesting.
Yeah.
Okay, awesome. Thank you so much. I'm going to toss it over to Sherry.
Hi, Sherry.
for our wrap up here.
Yes. Hi. Can you hear me okay?
Yes, we can.
Okay. Sorry I was so quiet on the call. I had a few technical issues. And I guess that meant I was just supposed to sit and listen. And I was absolutely mesmerized. So thank you so much, Susan.
You're welcome.
And we are really excited because you'll be joining us again on March 23rd to talk about thyroid. And you mentioned that a couple of times today. And I made a lot of notes, and I made a point of writing that down. And also again on April 16th to talk about fertility. And so we'll see you again a couple more times. And I'm guessing that there will be people reaching out to you and to Alethea as a result of that fantastic presentation you shared with us today. So thanks so much again. We had over 50 people on the YouTube today. So that's really, really wonderful. So looking forward to seeing you. I'll be back for the next one too. So I'm excited to see you again. Thanks so much.
Thank you.
Awesome.
Bye, everyone.
Okay. Bye, everyone.
Thanks for having me as your host too.
Yeah,
Thanks, Anna.
Everyone, bye.